Welcome back to The Big Picture, 9:32. Joining us right now is Dr. Zachary Bittinger from the Ohio State University Wexner Medical Center. Thanks for coming in, talking with us. Obviously,
sensitive topic for
Bryn
me,
is,
a little bit.
Bryn is a chronic offender of this.
I know.
1 in 7 people do not have a primary care doctor. 1 in 3 miss their, just a yearly checkup. I guess the big question is why? What is the drive? Is there a driving factor?
I think the bigger problem is that there are lots of factors, right? First is convenience, right? Life is getting busier by the day. And so it might seem easy to let one well appointment, if you don't have a problem, slip away. I think another is cost. Again, as the years go by, things get more expensive, especially healthcare. So seeing our doctor might be a source of worry for some folks to make sure that they can afford it. But also maybe we don't do a good job of making sure people understand why it's important. The things that we need to do to stay on top of our health, even when we're young. So I think there's lots of factors that I think contribute to people missing their appointments with their doctors.
I just know in my 20s, I was moving around a lot. I was in college in a different state. I moved to 3 different cities. I'd been all over the place in 2-year time periods. And I always was like, if I'm sick or if I get a cold, I'm going to go to an urgent care. What are some of the common reasons that patients give you for skipping for so long? Because I just gave you what mine was.
Well, I think you bring up an excellent point that a big gap for well visits is for young adults. Maybe if you move away for college, you move away for work, you're actually transitioning away from your pediatrician who you've seen for many years, and now you have to find a whole new adult doctor. That's a gap where it's very easy for young adults to fall through the cracks. And so I think when it comes to our well young adults that don't take medicines, don't see any specialists, maybe it's okay that they skate by for a couple of years. An urgent care visit for some belly pain or a turned ankle, not a bad thing. But if you see a couple doctors, if you take a couple medicines, who's responsible for those? Is it your previous doctor who maybe lives a couple states away or who hasn't seen you for a couple of years? That's just not good practice.
Right. Because I know when I turned 30, not to give my age away, whatever, I don't care. I was like, I need to get my health together. I'm not getting younger. I'm not invincible anymore. You know what I mean? Do you feel like you have a lot of 30-year-olds, that kind of age range starting to come in more than the younger adults?
Absolutely. It's especially around that range where people realize that we don't live forever. So we start taking our lifestyle more seriously, our sleep, our exercise, our diet. We start thinking about those preventative labs or those preventative tests. But there are things even younger that we need to talk about. And so that trend of younger folks kind of slipping by, but older folks having doctors and visits consistently, I think stays true.
Right. And I mean, when it comes to, some people think, you only go when I, feel ill, and some of that reasoning is, well, I don't have it. I feel like there's nothing wrong with me, so why do I need to go to an appointment? Well, when it comes to primary care, your doctor, your PA or nurse practitioner is keeping track of a whole lot of things that you don't really think about. So, what are some of those things that, as, a primary care physician, you're watching at all times?
When it comes to the preventative things, my primary example is tetanus shots. We get our first adult dose of that around 14 or so, and then you're set for 10 years. It's a nice long time to forget about it.
Yeah.
And then suddenly we snap our fingers, we're 24, and you need another one. Another one is Pap smears for our female patients. That's something where you don't have one, then suddenly we're 21, and we're talking already about cancer prevention.
Mm-hmm.
So these are things that young adults, let's be honest, probably don't worry about, they don't think about. Because if you step on a nail, you'll go see an urgent care, they'll give you a tetanus shot. But wouldn't it be nice if you could see a doctor that knows you, that knows your history, and that can walk you through those steps even before you need it?
Absolutely. And what would you say to someone who is avoiding going to the doctor because they're fearful of finding something out? I think doctors, you guys have to emotionally walk patients through a lot as well, not just, science. So what would you say to someone who's scared?
I think it comes down to 2 factors. One is trust. We got to trust the doctors that we see. And if you've set up an appointment with somebody or had a visit or two and you're just not quite sure about that relationship, that's okay. We don't take that personally. We got to trust who we see. And so, not that I'm recommending doctor shopping, but if we see another doctor, maybe another after that, to get the right feel, that's important. I think the unfortunate truth is, for that second point, bad things are going to happen anyway.
Mm-hmm.
And our best shot at helping people is finding those bad things as soon as humanly possible so that the treatment is easy, the treatment is simple, the treatment is safe, And that's our job, is to kind of stay on top of things so that people know their health even before they have a symptom.
Right. We know in a lot of, chronic illness and whatnot, early detection is so critical. And that is something that comes with a yearly physical, things like that, that if not, those things can go undetected.
Absolutely. That's one of my favorite parts of my job, is talking about the doctors we see, talking about the medicines we take. I call it quarterbacking medicine, right? As a primary doctor, your job is to know all the other people's jobs at least a little bit. And so it's a nice skill set to have for folks, even if they're not actively seeing one of their specialists.
And I know you kind of touched on like why pap smears are important for young women, but what other specific conditions do people really need to be regularly checking with their primary care doctor?
Well, especially when we talk about our young folks, it's sensitive things, right? Talking about our substance use, talking about our mental health, talking about our sexual health. These are things that, again, we come back to that relationship with your doctor. If you don't feel like you can share those things in a safe, trustworthy way with your doctor, you need a new doctor, because those are things that set up your health when you're young, when you're in your middle age, and when you're in your older age.
Mm-hmm.
So for someone shopping around right now trying to figure out how to get into a primary care doctor, what are the first steps? Because when you type it into Google, primary care doctor,
You're going to
get
get
a little
1,000
overwhelming.
results.
Yeah.
Yes. I think, for better or worse, the first step for most patients should be your insurance company, right? The doctors that we see, we got to the best of our abilities, make sure they're affordable. And so lots of insurance websites have find a doc options where you can go by how long they've been in practice, where they are, those kinds of things. And so if you feel reassured that they're going to be covered, all right, do we have preference on gender? Do we have preference on their subspecialties? Those are kinds of things where we can kind of fine tune to the best of our abilities before we end up on their doorstep.
Mm-hmm. As a chronic urgent care user for many years, I have found, now that I have a primary care doctor, it is so much easier to work with her and message her and set up appointments. It really is. And I'm saving money, actually, I think, instead of just going in and paying an urgent care like $50, $60.
My chart messages might be a little bit of a difficult thing to navigate for lots of us, because there are many of them. But it's a great way for us to keep patients healthy, even from a distance. It's a great way to answer questions. Mm-hmm. So there are so many tools that we then have access to if we just set up with somebody on a regular basis.
Awesome. Thank you so much.
Yeah.